So parvovirus is a virus, just like COVID is a virus, influenza is a virus. It affects the GI tract, so it causes vomiting, diarrhea, inappetence, and it affects the bone marrow. And the bone marrow is what's responsible for our immune system. So while making the dog sick through the GI tract, it also takes away their natural defenses to be able to fight it off. We have very effective vaccines for this now. They go through a 3-vaccine series. So let's say you get your puppy at 8 weeks of age. They get a vaccine at 8 weeks, 12 weeks, and 15 weeks, and then they're considered protective. But until that final vaccine at 15 or 16 weeks, this is a highly contagious virus that can be devastating for the puppy's immune system and GI tract. And so until they're fully vaccinated, I strongly encourage people not to take them out to uncontrolled areas. It's still good for them to get exposure to other dogs and other people, but you want to make sure you're taking them to places that haven't seen parvo. Parvovirus can live in the environment for over 6 months. So if a dog goes through a park and has parvovirus and you have no clue about it, and then 2 months later, you walk your 8-week-old puppy through that same area, your puppy can contract parvo without you even realizing it. So just protecting them for the first 4 months of their life to make sure they're not exposed is critical. So puppies are very susceptible to dehydration. So even if it's not parvo, if it's any other cause, as soon as a puppy is showing vomiting, diarrhea, not wanting to eat, they need to be seen. I would say within 24 hours, because at this age, we're talking an 8 to 12-week-old puppy, they don't have a lot of reserves to save them for. So I would get them to a vet clinic, have them evaluated. Any puppy that comes in that's not through its vaccine series, the first thing we're going to do is parvo test them to see if it's parvo or not. And then we treat appropriately according to which it is. But the most important thing is to establish a relationship with your veterinarian as soon as you get a new dog to make sure they get the care they need. Anything that can be bleached should be bleached. It's like a 10% bleach solution. Obviously, you can't bleach your couch. And as soon as you get a new puppy, he's everywhere in the house. So steam cleaning the couch, steam cleaning the carpets can help. But you really need a deep clean, especially if you have another dog or if you live in an apartment complex. So if you live in an apartment complex and you've been walking your dog out in the areas, it's not an easy conversation to have. But if you know of anyone else in the neighborhood or the complex that has a puppy, letting them know that it's there. It's not a stigma on you that your dog got parvo, but by sharing that information with your neighbors, they may help to give you some support that you need. But definitely talk to your veterinarian, because a veterinarian can give you some good guidelines depending on where you live is what you need to do at home and to protect your other dogs.